Just before Christmas, thousands of Connecticut seniors and disabled people were filled with anxiety because the state was about to cut them off from the popular Medicare savings program. But at the very last minute, lawmakers fixed the funding problem and the checks kept going out.
That anxiety is back because that fix was only temporary. Now it's down to just 13 days before a decision must be made. Chief Political Correspondent Mark Davis joining us live with more on this tonight. Good evening, Mark.
Hi, Scott and Ann. Good evening, everyone from the Hartford newsroom. Once again, 113,000 Connecticut residents, seniors and the disabled, as you said, are facing another deadline. This time it's July the 1st for the checks to stop under the Medicare Savings Program, commonly called the MSP. It covers Medicare Part B premiums and copays. Thousands of Connecticut low-income seniors and the disabled are again facing the stress of possibly losing a crucial part of their monthly income. The Department of Social Services says they are ready to send letters to thousands next month, advising them of big changes in the Medicare Savings Program and the Renters Relief Program. It's all because of the current stalemate at the Capitol on starting negotiations to solve a $360 million hole in the current budget year. When lawmakers voted to fix the programs late last year, the fix was only for 6 months. Once again, lawmakers are hearing from people all over the state.
They're concerned that the funding is going to go away, quite frankly, and really what they're most concerned about is the uncertainty.
They're saying that this is a lifeline, that this is going to make them choose between medication and food, and that is the reality of this program.
Instead of getting a direct response of when we're going to meet, I get tweeted at.
The House Speaker expressing frustration today that bipartisan talks that could address this have not yet started.
People are looking at us to make decisions to correct some of those programs, and we intend to. If the Republicans want to pass and not take part in that, then that's on them.
MSP we do need to fix, but we need to fix it in the context of the budget, because we are still looking at a deficit in 2018, the current year, and in 19.
But over at the tax department, the cash keeps pouring in way over what was expected. So you may be asking, what's the problem?
The problem is that in the long term, if you look at the out years, we have massive deficits.
Now that extra money, as I'm describing it, money that's more than what they anticipated from the tax filings on April 17th, is now pegged at over $1.2 billion. But because of a new law passed last October, that money is supposed to go into the rainy day fund to cover those out years when more deficits are anticipated. There are 2 budget plans on the table over there at the Capitol. Both of them would reduce Medicare Savings Plan recipients, but not so drastically as a cutoff on July 1 if they do nothing. Live from the Hartford newsroom, Mark Davis, News 8.